Happy day. I'm Dr. Paula Newsome.
And I'm registered nurse Tracy Young.
And together we're the educational faculty for Knockout Diabetes, where K stands for knowledge, N stands for nutrition, O stands for ocular health, and C stands for coaching.
So right now I'm going to walk you through some deep breath exercises. And this is very important to take some deep cleansing breaths throughout the day. You may be stressed out, you may have a challenging situation, and you just need to calm down for a moment. And so this is something that you can do anytime throughout the day.
Did you know that you can control your blood pressure by breathing? Did you know that you can de-stress by breathing? You know that you can actually not necessarily engage a lot of endorphins, but you can even change your mood by breathing. That breath is so very powerful. So this is probably one of the most important exercises that we can share with you.
Absolutely. So as we walk through these deep breathing exercises, I want to make sure that you're in a quiet and calm environment. Have a chair that has some back support, maybe arm support if you need it. Your feet should be placed flat on the floor with your legs uncrossed. And also, if you want to relax back in your chair to have your back supported, I'm going to ask you to close your eyes throughout this segment to get yourself ready for the deep breathing exercises. You're going to hear me say inhale and exhale and kind of give you a guide as to how long to hold your breaths and exhale. But I do want you to keep in mind to still do what is within your comfort level, especially if this is your first time going through deep breathing exercises. I want to make sure that you're also breathing in through your nose and exhaling out through your mouth. And as we go through the exercises, I'll make sure to guide you. So let's go ahead and get started. So close your eyes, and here we go. Take a deep breath in, 2, 3, 4, and exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4, and exhale, 2, 3, 4, 5, 6. Inhale, make sure you're inhaling through your nose, and exhale, blowing out that cleansing breath through your mouth. And inhale again, and exhale. Inhale, and exhale. Inhale through your nose, and exhale through your mouth. Inhale and exhale. Make sure you keep your feet flat on the floor. Inhale. And last one, exhale. Wonderful. How do you feel?
Excellent.
Right?
Excellent.
It's such a great exercise that you can practice at any time to kind of help yourself be calm and come down from any kind of stressful day or an event that you're having, or just to kind of clear your mind of any negative thoughts you may be having.
I actually even inhale and exhale even slower. I even just kind of relish that breath. So I even do it at a slower count.
Absolutely.
Because my day is so hectic that I don't want that same speed. I want to
slow
really,
it down.
Yes.
Absolutely. So you can do these exercises at your own pace. It is important to have your exhale be a little bit longer than your inhale to really blow out any of that negative energy or any of that old air that's kind of circulating through your lungs. So thank you so much for watching these breathing exercises.
We want you to be well,
stay healthy,
and stay the course as we knock out diabetes.
Happy day and welcome to our program, Knockout Diabetes. I am registered nurse Tracy Young, and I'm here today to walk you through our weekly exercise regimen and introduce you to our Knockout Diabetes community. One of our program goals is to increase your activity to 150 minutes per week. That breaks down to about 30 minutes a day, and you can get that 30 minutes in each day by breaking that down in 10-minute increments after each meal. By exercising after each meal, that will give you really good effects on helping to lower that blood glucose throughout the day. I do want to give you a couple of reminders before we get started. Make sure that before you start any exercise program, you do consult with your healthcare provider. You want to make sure that you adjust your medication appropriately, as exercising does bring down your blood glucose numbers. You may have any snacks that are needed to combat any hypoglycemia or low blood sugar. You want to make sure that you have a bottle of water or something next to you so that way you can stay hydrated. Some symptoms of hypoglycemia can include shakiness, feeling dizzy, blurred vision, or being excessively thirsty. So please be mindful and pay attention to your body and your body's cues as we go through the video. You can pause this at any time and make sure that you work at your own pace. Let's go ahead and get started. So first we're going to start with our warm-up. It's very important to do a warm-up. That way you can get your body ready for the exercise that we're getting ready to do. And warm-up is going to include exercises that are very low intensity just to get your muscles and your body ready for movement. Our first warm-up exercise is going to be the shoulder squeeze. We're going to squeeze our shoulders to the back and we're going to do 10 reps. Let's get started. Very good. Our next exercise will be exercising our neck. And we used to do the neck roll, but now we're going to take one ear and touch it to the shoulder and do that on the opposite side as well. And then take our chin and put it to our chest and then also move our head to the back. So we'll go ahead and demonstrate that. Let's get started. Again. Again. One more. Excellent. The next warm-up exercise we'll do is arm circles. You're going to have your arms right out to the side of you. We're going to circle 25 seconds in one direction and then 25 seconds in the opposite direction. Let's get started. Forward. And backwards. And arms down. Great job. Make sure that you take time to see how are you feeling. Take a check-in whether or not you need to take a break, hydrate with some water, or continue going. You can pause this video at any time. Our next warm-up exercise is going to be high knees. And for this exercise, you will hold your hands out in front of you and touch your knee to your hand for each repetition. If you are unsteady or you need a little bit of support, you can use a wall next to you or you can use a chair. For this exercise, we will do 20 repetitions. Let's go ahead and get started.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Great job. Our next exercise is going to be side stretches. And for this exercise, we are going to stretch to one side. We're going to do that 5 times and hold each repetition for 5 seconds and then do it again on the opposite side. So we're going to start going this direction first. Let's get started. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Opposite side. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Very good. Now that we're finished with our warm-up, we're going to move into our exercise pieces. Our first exercise is going to be the good old sit-up. So we're going to sit on the floor with your feet flat on the floor. And if you need anything to hold your feet down, or if you're working out with someone, you can enlist their help to kind of hold your feet down. And we're going to go ahead and do 3 sets of 10 sit-ups for this exercise. You're going to place your hands behind the bottom of your head, and when you sit up, you're going to push your chin straight up to the ceiling. That way you get really good form. So let's go ahead and get started. All right. Our next exercise is going to be the bicycle. For this, we have the similar position as the sit-up, but we're going to lay flat on our back with our feet at a 90-degree angle as we move our legs as if we are riding a bicycle. We're going to do 2 sets of 30 seconds for these. Let's go ahead and get started. Our next exercise is the plank exercise. This exercise is really going to help with your core muscle and core muscle control. For this exercise, you are going to be on your stomach. You are going to have your elbows nice in front of you, and you're also going to have your feet on your toes behind you. We're going to push up in the plank position and hold this position for 15 seconds, and we will do this 2 times. Let's go ahead and get started. Our next exercise is going to be the bridge, or what we call hip extension. And for this exercise, you will be seated on the ground with your feet flat on the floor. Our backs are also going to be flat on the floor, and we're going to lift our hips up to the ceiling. For this exercise, we're going to do 3 sets and hold them for 10 seconds each. Let's get started. Place your hands flat on the floor and place your feet about hip width apart. And when you're ready, we'll go ahead and lift straight up. So for our next exercise, we are going to do tricep extension. So you'll see that we do have weights here, but I want you to know that this exercise can be done without weights. You can use anything that you have at your home, such as a coffee mug or a can or anything that you have to just give a little bit of weight. And if you don't want to use weight at all, or if you have any kind of restrictions to this, you don't have to use weights, but we are going to use them for the purpose of this video. So with this, what we're going to do is hold this weight in our hands. We're going to place our arms back behind our heads with our elbows pointing straight up to the air, and then we are going to extend. We're going to do this 10 times, and we're going to do it for 3 sets. So let's get started. Our next exercise is going to be the bicep curl. Again, we do have our weights here, but the bicep curl can be done or modified with a can or a coffee mug or anything that you have at your home to give you a little bit of extra weight. This exercise can also be done without any weight at all by simply just moving your arms to get that mobility in your joints. Now, we will be demonstrating single bicep curls, but you can also do a double bicep curl where you hold your can or your weight in your hand and you simply move up and down like this. So there are many ways to modify this exercise but still get the benefit. We are going to do 10 curls on each arm. We're going to start with our right arm first and then move to our left arm. So let's go ahead and get started. Awesome. Switch arms. Very good. Our next exercise is going to be the jumping jack. We're going to do 3 sets of 10. Let's go ahead and get started. Ready? Go. Now it's time to cool down, and this is a very important part of any exercise as it helps your body recover from the exercises that we did previously or in any workout that you participate in. So now we're going to start with the abdominal stretch. For this stretch, you are going to have your hands flat on the floor, your elbows about shoulder width apart, and we're going to push up to stretch our abdominal cavity. And what we're going to do is stretch for about 10 seconds and do this 3 times. Let's go ahead and get started. Okay? Now. And again. Our next cool down stretch is going to be the sit and reach. So for this, you're going to sit on the floor with your feet straight out in front of you and try to pull your feet back to your knees so they're kind of at a 90-degree angle or a little bit more, so you feel that stretch right in the back of your legs. We're then going to reach to touch our toes, and we're going to hold this stretch for 10 seconds, and we're going to do it 3 times. Ready? And relax. And again. And relax. And again. And relax. For our final cool down activity, we're going to breathe in for a count of 8 and breathe out for a count of 8. For this activity, you will sit on the floor, and if you can, cross your legs or just in any kind of comfortable position that suits you. We are going to breathe in, and we're going to raise our arms above our head, and then we will count to 8, and then we will breathe out and bring our arms down for another count of 8, and we'll repeat this 3 times. Let's go ahead and get started. Go. Breathe in. And breathe out. Breathe in. And breathe out. Breathe in. And breathe out. Awesome job completing this workout with Knockout Diabetes. As always, we want you to
be well,
stay healthy,
and stay the course as we
knock out diabetes.
Happy day. I'm Dr. Paula Newsome.
And I'm registered nurse Tracy Young.
And together we are the educational faculty for our program entitled Knockout Diabetes, where K stands for knowledge, N stands for nutrition, O stands for ocular health, and C stands for coaching. Today, we are just excited to have you join us because we know that you're really braving new territory. So, for openers, I'd like for you just to take a second to think about the first letter of your first name. For instance, my first name begins with a P, and we want you to write down a word that is either a fruit or a vegetable that describes you. So, for instance, I'm going to write down pear. Because I'm a little sweet and tart at the same time.
At the same time.
Yes.
And for me, Tracy, T is the first letter of my name, and I choose the fruit tangerine.
And what?
Kind of for the same reasons. A little bit of sweet and a little bit of sour.
Okay. Well, I wasn't sour, just tangy. Okay. Let's make sure. All right.
So we want to celebrate. Thank you for being here. We just want to say thank you for being here on this journey, and we want to empower you. Whether you have a new diagnosis of diabetes or you've had diabetes long term, maybe you have a diagnosis of pre-diabetes, or you're just here for information. We just want to celebrate that you have joined our program and you're here to get some new information.
So do you realize, Tracy, that there are people who really don't like change at all?
Absolutely.
And change is one of the most frightening things for people to even encounter or embark upon. And the reason for that is because it's unfamiliar.
Correct.
And so the fact that we have people joining us is something to celebrate about.
Yes.
Because they're willing to take that first step, that
That's
exciting step,
Absolutely.
to make a change not only in their lives, but in the lives of their sphere of influence.
Absolutely.
And so not only will they be able to change themselves, but they'll also be able to exert some change in the lives of others they touch.
Absolutely.
So that's pretty powerful.
It is very powerful. So let's just take a moment and pause. Let's just take a couple of moments to write down why you're here. Just whether it's for that change, if it's to influence someone else in your life, whatever the reason is. Just take a few moments and write down why you're here. And whatever the reason, make sure that in that we are celebrating you. Y-O-U.
You know, in our society, there are just tons of things that are wearing us down. There are tons of things that rob our talent and our time and our resources. So we want you to carve out some time so you can concentrate on you. It's interesting. Yesterday I was talking to someone who was bringing in a child to have their eyes examined. But this lady had not had her eyes examined in years. And I said, at the end of the day,
Right.
all you have when that last breath is taken is you.
That's right.
And so we're glad that you're taking some time now to concentrate on you. We have all kinds of bills, financial obligations. We have all kinds of destructive relationships. We have toxic people in our lives. But today, it's all about Y-O-U. So let's just share some diabetes factoids.
Absolutely. So did you all know that diabetes is the 7th largest killer for people in the United States?
Wow.
The 7th. I
Wow.
mean, that's very high.
Wow.
It's also one of the leading causes for new onset of blindness in the United States.
Wow. Every 10 seconds in the United States, someone dies from complications of diabetes. Also, every 10 seconds, 2 people are diagnosed with diabetes.
And roughly about 10% of the population of the United States has diabetes today.
And by 2020, 1 out of every 3 people will be diagnosed with diabetes based upon the number of people now that either have prediabetes, or who are undiagnosed. It is projected that 1 out of every 3 people by 2050, which is a very short time from
It'll
now,
be here before we know it.
Yep, exactly, will have diabetes. So that is a ton of people. There are 23.1 million people who are diagnosed, 7.2 million, or roughly 24% of people with diabetes are undiagnosed.
Absolutely. Some more information. So about 25% of all people, like you were saying, that have diabetes are undiagnosed. And about 50% are Asian Americans, Hispanic population, Hispanic Americans are undiagnosed as well. And most people who have prediabetes are undiagnosed. And the length of time that a person has hyperglycemia, which is increased amount of glucose in your bloodstream, it's effective regarding the disease burden on your body.
So one of the reasons that we came up with this program was to decrease, stabilize, and arrest the ill effects that diabetes type 2 causes on people who are or have been diagnosed as having diabetes using the 4 pillars that we talked about earlier: knowledge, nutrition, ocular health, and coaching.
Some of our goals for you as a participant, we want to reduce the negative effects of diabetes mellitus type 2 on your daily, on your eyes by daily monitoring. We also want to better control the disease by weekly monitoring and reporting. We also want you to increase your physical exercise and or activity by at least 150 minutes per week, and also to lose roughly 5% of your initial body weight. So just taking your weight today, and that 5% would be one of our goals for you over the program time.
So let's just say you weigh 200 pounds. We're talking about 10 pounds of weight loss, which is really not a lot. And when you consider the fact that a good weight loss per week is 0.5 to 2, it's really not a lot, especially if you're talking about a 6-month time frame. Also, consider 150 minutes per week is like 30 minutes for a 5-day week.
That's it.
So it's really not a lot. But we're going to share some tips with you to make exercise more fun. I just want to share a factoid with you. I was Googling today because I was interested in quality of life kind of issues and how they really impact people. And I found out that 70% of chronic disease is due to smoking, inactivity, and poor nutrition.
Lifestyle.
70%. So those are all things that we can change. And so this program is all about moving you on the willingness to change continuum so that you will feel empowered to take control over your life.
Absolutely, and that's good. I mean, 70%, wow.
That's a lot.
It's a lot.
That's significant. And that's chronic disease.
Right,
that's chronic disease.
Absolutely.
And chronic disease also kind of goes hand in hand with depression as well, too.
Absolutely.
So, because people don't like the fact that they've got this disease for a long period of time.
That's right.
So now we're not just talking about a physical effect, we're also talking about an emotional and a psychological effect.
Absolutely.
In addition to the actual physical malady.
Exactly.
So,
absolutely. All good points. So a few more participant goals. We want to make sure that we expand your knowledge. So one of our goals is just to hope that you learn something today, even if it's just one thing, although we feel like we'll have a lot of things that you'll learn new today and throughout this program. But want to know more about the effects of diabetes on the eyes, the effects of diabetes just throughout our body, our teeth, our feet, our kidneys, things like that. Also want to assess where are you on that continuum of change. That is a huge part of this program. Like you said earlier, just logging on, watching these videos, joining this program means that you are ready for a change, and that's awesome.
Absolutely. We also want you to break through barriers to bring about sustainable change. So anybody can do anything for a minute or a couple minutes, but it's about lifestyle changes, and that's what we're hoping we're going to share with you so that we can really affect change. We also want to enhance the quality of your life by adopting new habits leading to new lifelong behaviors.
And participants that are in our online community, we really want you to try to interact with other participants in your coaches weekly.
Absolutely. So, how many people know what the difference is between a goal versus a dream?
This is good.
Yeah. So, does everybody dream?
I hope so.
Does everybody think they have goals? A goal is a dream dressed up in work clothes, and a dream is some future outcome, but a goal is a future action.
Absolutely.
Yeah. So a goal without a plan is just a dream.
That's right. So goals require action, whereas dreams can occur just naturally without any kind of action behind it. They can just occur while you're sleeping, while you're daydreaming. But a goal is something that you actually have to put a plan in place and take action.
Absolutely. So we're going to share with you SMART goals. We certainly didn't come up with SMART goals. SMART goals have been out a lot longer than we have been born. But that SMART goals, SMART is an acronym. The S in SMART goals stands for specific. So anytime you're writing a goal, you want to be very specific about what it is that you want. I was talking to someone earlier today, and they shared that they wanted $1 million. Now, they didn't say how they wanted that $1 million. They didn't say if they wanted the $1 million in fives, tens, or ones. They didn't say if they wanted to rob a bank to get the $1 million.
They just want it.
They just wanted $1 million. Sounds like a dream to me. So if you want to be specific, what you want to do is, how do I look at all of my resources and where I am, and how can I come up with a plan to actualize that $1 million? I think goals are much better. You know, it's kind of like, how do you tackle an elephant? You tackle an elephant one bite at a time.
That's right.
So, you know, maybe the goal should not be I want $1 million. Maybe the goal is I start with 1,000 and then I multiply that and I multiply that and I multiply that so that I can get to that $1 million. And I take that 1,000 and multiply it into $1 million. But goals need to be very, very specific.
Okay, so moving on to the M in SMART, which is going to be measurable. And what that means is you have to set, not only be specific, but with that measurable, you have to have a time or a date or a way that you're going to measure that goal. So going back to your example of the $1 million and taking 1,000 and multiplying that. So how are you going to measure your progress towards the specific goal that you have started?
In other words, this morning when I set out at 6:30 to go do my 3 miles, instead of looking at where I was going to end up, I looked at how long I could be out before I needed to come back so I could be here in time to do this taping. And so you want to look at measurable quantities. You want to look at a cup. You want to look at an hour. You want to look at something that you can measure.
Absolutely.
That A stands for actionable. Is it actionable? Can I literally go out here and bite an elephant? I probably cannot. But what can I do? There are some things that I can do. So I may not be able to go out and make $1 million today, but there are some things that I can do that will get me closer and closer to my goal.
Absolutely.
So make sure it's actionable. Is that something that I can do? in a reasonable amount of time.
Absolutely. The R in SMART is going to stand for realistic. So is that something that I realistically can do? Do I have the resources to realistically meet this goal? And if not, what resources do I have to start moving towards that goal? So making sure that, your dream is very large. It's this, you have this huge idea. That is your dream. So now how can you work towards that dream and make it into a goal and also make it realistic? So also meaning, if you say, okay, I want to lose 50 pounds, right? But right now, you're not doing any activity. You're sitting at home, or maybe your job is working from home, and you're not able to get that 30 minutes of activity each day. So 50 pounds may not be a realistic goal. So let's start with something that's more realistic, like that 5 pounds that can lead to your 10 pounds, that will lead to your 50 pounds.
Right. And that T is time related. We have to have a start time and we have to have an end time. So we've run this program maybe 4 times now, maybe 5, not sure which, but I know we always have our best results when people take smaller goals, and once they reach that smaller timeline, then they set a new goal.
That's right.
So instead of trying to lose 100 pounds at a time or 50 pounds at a time, losing 5 pounds and then another 5 pounds and then another 5 pounds, and then it starts to add up.
That's
and
right.
You build momentum, and then you have some successes,
Yes.
and then you know what to do, and then you just keep it going, because now it's a way of life.
Absolutely.
So when Tracy and I first met each other, I actually needed to lose some weight. I was going through a really rough period in my life. My mother had passed, and I started adopting some really bad habits. And in the process of adopting the bad habits, I'd gained some weight, and I really just was a little depressed and didn't really care. And at the time, this is probably TMI, but I'm just going to share it. It's just us, so it's okay. My thighs were rubbing together. I could walk and I could exercise, but I surely was not in the shape that I am now. And some 2 to 3 years later of doing the same thing and sticking with it, and you're a witness.
Yes.
You're a witness.
Yes.
You've seen.
Yes.
They work.
They
So
do.
I'm here as a witness to tell you. Tracy, why don't you share about how you went back to school as a mother,
Yes.
a single mother, and just
Yes.
finished your RN.
That's right.
Yeah.
So I just finished my registered nurse degree, passed my license exam and my boards, and woo-hoo. But it's just like any goal. You just set a goal out, you set a time, and you stay consistent. Had to study consistently, make sure that I, still make time for my family, and, just really set a schedule and stick to it. And the thing about goals is they're not easy. When you were starting out on your walks, I just seen you go from I did a little bit, I did a little more, I did a little more, and being consistent. And that's also what I had to do in school. And here we are as, living examples of how you can achieve your goals.
Absolutely. Absolutely. So let's take a few minutes now for you to write down a SMART goal. You can write it down in any area you want to write it down. You can write it down spiritually. You can write it down physically. You can write it down emotionally. You can write it down financially. Just whatever seems to work for you. I want you to take just a couple minutes now and write down a SMART goal, making sure that it is specific, measurable, actionable, realistic, and time related.
Yes. All right, so as we begin on this journey, we want you to know that we care. We are here for you. So you can always reach out to us with any questions that you may have, any concerns that you may have, and just fasten your seatbelt because we are ready to go on this ride with you.
We want you to enjoy your journey. We want you to keep track of all of those specific goals that you wrote. We want you to contact us, and we'll send you your participation packets should you need. And we have a 10 for 10 pledge. This is something that we want you to say every week, and we'll talk to you about some skills and tools so you can remember what they are. But as a participant in the program, we want you to commit to monitoring your vision daily. We want you to monitor your food intake daily.
We want you to monitor your blood glucose daily. We want you to keep up with your program materials. We want you to write in your journal how you're feeling, the times that you feel in control, times you feel out of control, and what's happening. You know, what did you eat that day? Just kind of take a look at your day and recap.
Sometimes when things are going on around us, they really impact us more than we do, and you'd be surprised at how outside forces can influence you or impact your decisions and your behaviors. So it's really, really important that you capture what's going on in and around your situation that day. We also want you to be open to change behavior. That is so, so important. Remember, fluid is the word. We don't want any old, rigid, crotchety beliefs and ecosystems in here. We want you to be fluid. We also want you to check your feet daily. We know that some of you may have some physical constraints that won't allow you to check your feet physically looking, but we're going to teach you some ways that you can check your feet daily because it's so critical.
Absolutely. We also want you to increase your activity to at least 150 minutes per week. So whether it's exercise or activity, that is what we suggest so that way you can meet your 5% goal. And if you really want to not just maintain but increase, then bump that up to 240 minutes per week.
We want you to attend at least 80% of these modules, and if you miss a module, make sure you listen to that so you can get the information, because all of these modules feed on each other. We want you to fully participate in the Knockout Diabetes activities because we want you to be well,
stay healthy,
and stay the course as we
knock out diabetes.